Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health.
Hello again, everybody, and welcome to this edition of Doc Talk with Monument Health. Joining me again are Dr. Abbie Metzler, who is a non-ops sports doctor for Monument Health, correct?
Correct, yep.
And Kaleb Briney, who is the head athletic director for the School of Mines Hard Rockers.
Athletic trainer.
Athletic trainer. That's right. We talked about that in the hall. Anyway, thank you guys for joining us again. I encourage people to go and listen to the last time I had you guys on. We were just kind of getting an overview of sports medicine and what you guys do. And we, of course, talked about Damar Hamlin, and all of that was amazingly fascinating. And as we were getting ready for this podcast today, Kaleb, you started talking about corporate trainers, non-sports trainers. Right. And of course, the first thing that comes into my mind is, what does that mean? Right?
Absolutely.
So you guys do this same job in a non-sport setting.
Correct.
Like, what would some examples of that be?
Yeah, so there are athletic trainers at NASA. They're helping all the astronauts. They're helping them with whatever injuries they might go through in their training. And there's also athletic trainers at Boeing. There's athletic trainers at Amazon.
Amazon.
And so we're all over the place.
Yeah.
And they do a lot more kind of ergonomics, how you're doing your job and then keeping them safe. What they've seen is that you can get injured putting a plane together.
Sure. Yeah, I suppose.
And if then you're missing work. So if there's an athletic trainer there that can help protect that employee so that they can do their job safely, they're going to miss less work, which means more job.
So is it the same training that you guys have then? It's in essence kind of the same thing?
Yeah,
because you're looking at
same everything you go through. It's just you're focusing on more of, you're looking at how the body works, how the body moves, and then how you do that safely compared to maybe, cutting on a football field or, running into a 300-pound lineman. You're dealing with a plane or,
right.
Putting things in boxes and how you sit in a chair or at a desk. And we kind of cover a lot of things.
I suppose being cramped in one of those planes and sitting up quickly and banging your head could easily lead into what I want to talk to you about this podcast on. I stretch for that. I really do. But I think I got there with it. Anyway, it's concussion protocols, which is another phrase that I think a lot of people that watch any sort of sport are very familiar with now, because it seems like more and more attention is being paid to it, as obviously it should be, correct? Mm-hmm. We've seen, you go back into some of these older athletes. Well, you see a lot of athletes that have passed away way too young because of, I'm assuming, issues with concussions, correct? So can you just kind of explain a little bit, what is a concussion?
So a concussion I think the simplest way I can think of it is it's a functional dysregulation of your brain versus a structural. So we could do MRIs, CT scans, nothing's going to pop up on it. But it's actually how the function of your brain is working. And it's a dysregulation in that process of kind of what your brain is perceiving in the world around it and to how it's processing it.
But doesn't that happen because of damage to the head, getting hit in the head generally? I mean, you can't get a concussion without smacking your head against something, can you?
Correct.
Okay.
I mean, you can get like whiplash type concussions. You can get concussions from not truly hitting it, but it's that jarring movement of your brain inside. It's the skull essentially.
Okay.
But yeah, it's actually funny because there's still a lot of research that needs to be done at a very microscopic level what's happening. But what we do know is we can do all the scans right now and nothing's popping up.
Really? Mm-hmm. So when like I say in football or a car accident even, when your head slams into something and then your brain, I believe, in your skull hits your skull, doesn't it, in some instances? Can the fluid around there, it doesn't protect it completely, does it? I mean, is that what happens, sort of?
Yeah, I mean, really a lot of times it's probably the recoil.
Oh,
it's not the
sure.
actual impact. It's your
right.
head coming back. And it's just, so like, let's say you get in the front, a lot of times the concussion area could be perceived as the back.
Okay.
Because that's where the force is really going to be.
And so you're looking at CAT scans and you don't see that there's damage done with that in a lot of instances?
Not typically. Now, you can have, don't get me wrong, you can have a concussion that there was damage.
Right.
But you can have a concussion and there's absolutely nothing on
Okay.
the scan. And you can have findings that are really worrisome. You send them in, even as a provider, and there's nothing there.
Oh boy,
Yeah.
So is that frustrating? I mean, or do you can you always tell when somebody has a concussion?
It's a very gray area.
Okay.
There's some that are very obvious, like you can tell instantly they're nauseous, their head hurts, they're dizzy, they have all these symptoms. And then sometimes there's ones who are completely normal. Yeah, I'll have athletes who are like it popped up 24 hours later. And all of a sudden they woke up and it's almost like the world's spinning on them.
Really?
Yeah, so it is hard. It can be frustrating at times, especially I would say the recovery process for patients is hard because as a provider, you're trying to do all these different things because you have to treat it in just so many different elements. And some get better really fast and some take months.
Are there some myths with concussions that bug you guys?
Do not wake them up. That was an old thing we used to do in
Right.
sports medicine is wake them up every 2 hours. They actually really need sleep. As long as you can, kind of go through it, make sure there's nothing emergent, let them sleep.
Mm-hmm.
They need that sleep. Don't wake them up every 2 hours. That's probably the biggest one that I've actually seen recently still on an after visit summary type thing that a patient was given about concussion.
Oh, really?
Yep, and that's a big one we don't do that anymore.
Are there any others or is that kind of the main one that always seems to pop up?
Another one is just the type of concussion.
Yeah.
Because they used to say, oh, it's a mild concussion, it's a severe concussion. No, it's just a concussion. There's not really different stages of a concussion. If you have a concussion, you just have a concussion.
Oh, wow. Now, see, I didn't need to. It's kind of weird to have my mind blown there, but I kind of was with both of those. So obviously, as athletic trainers, when it comes to concussions and the protocols and stuff, this has to be that has to be a very crucial role for you guys when something like this happens. Mm-hmm. And I had in front of me here there were some key roles. That include things like prevention of concussions. I think would be the very first thing you guys would want to do is to prevent those. In football, the helmets, obviously. Baseball, probably the helmets too. Hockey, same. But how can you prevent in a sport like golf or in a sport like basketball, where there generally isn't that head protection all the time?
Well, sadly, the head protection doesn't actually protect your brain.
I
It
suppose,
protects you
'cause
more
we
from
still see
skull
it.
fractures.
Okay.
Now it helps to an extent. A lot of in football, we've changed how you tackle. You put your head behind instead of in front, so your head's not taking a lot of the impact. So a lot of the concussion prevention in football and some of those sports specifically is how you actually do the sport.
Right.
You're not using your head as a weapon.
You're not supposed to.
Exactly.
Right?
And you see that a lot of frustration in the NFL where you feel like it's not as physical as it used to be, but it's really we're protecting our athletes.
Right.
Other sports, again, there's no really way to protect. It's you do your best to make sure their neck's strong so they don't have that big whiplash. They can control it a little bit more. In basketball, you see a lot of times when they're taking a charge or if there's a collision, it's really the head hitting the ground. On the fall, and so you teach them to fall with their chin to their chest. And so it's just little things like that. Golf, if you get hit by a ball, you're probably just screwed.
Well, if you're getting hit with a ball in golf, you've done something pretty wrong, I would think,
and
too.
it's probably not happening at a college level, right? You would hopefully know,
Exactly. It's funny you mentioned when you're talking about football and keeping your neck strong. I remember you used to see those guys wear those big pads that would go around their neck. Mm-hmm. You don't see that as much anymore. Did they work or not? I mean, why don't we?
I mean, I would say those were really more for the neck.
Okay.
And now we really focus on face-up tackling. So you want to be able to see what you're tackling compared to putting your head down and leading with the crown of your helmet. And so that would actually limit you from being able to look up and have that full range of motion in your neck to actually see what you're hitting. And then, because if you hit with the crown of your helmet, not only are you putting yourself at risk of a concussion, but you're looking at a neck injury too.
Yeah. There's been in some fringe areas of football protection, people have talked about going back to leather helmets to prevent these guys from doing that sort of stuff. I don't think you guys would recommend that, would you?
No, I don't think, I've heard that same thing, and not necessarily the leather helmets, but from like rugby players.
Yeah.
Like that's who I hear say it the most, because they're like, we don't get as many concussions. I just
Is that
don't.
true? Can that be true?
But again, football's progressing to kind of, take the way, if you watch the way a rugby player tackles compared to how a football player tackles, when you don't have the protection of all of the padding, you're going to protect your body.
A lot.
So you're not going to use your head. You're going to put, like, if someone's running and you're going from the side, you're going to put your head behind them so they're not hitting your head or putting your head in between them and the ground. And so we've kind of taken some of those lessons from rugby to help us in football.
So then the next step here would probably be like evaluation and treatment. So how do you evaluate when you think somebody has that concussion?
So there's actually a pretty extensive thing we go through. There's
These would be the protocols then, correct?
Yep. There's what's called a SCAT-5, but then we also use SWAY now too.
Yeah, I want to talk about that coming up. Sure.
Yeah. So essentially, any of these tools at the end of the day. So we'll screen you before the season. We ensure that kind of what you look like preseason, because there's certain reaction times that can change. And then the initial eval on like the sidelines is really like trying to assess what's like concentration, how are your eyes looking, how's your neurofunction looking, and it's essentially doing this quick neuro assessment to see how your brain's functioning.
So then what's the treatment for it once you guys have determined?
Well, it kind of depends, and there's actually going to be some new research coming out very soon.
Okay.
That's going to kind of change it just a little bit.
Really?
But one of the biggest things is to kind of let them just rest, especially for the first like 24, 48 hours. Other than that, you really just want to make sure you're not making the symptoms worse. So maybe going for a walk is going to be okay here soon. It's going to be okay to maybe walk or ride a bike just enough that you're not making anything worse, but you're keeping the symptoms in check. So really all you want to do is you want to keep the symptoms in check, make sure nothing's getting worse. Then obviously in the first 24 hours you want to make sure that you're not having any vomiting or some of the more serious aspects that can come with concussions.
What are some of the symptoms? I don't think we covered that that you guys look for, that if you think you have it, you should talk to somebody about.
There's a whole host of them, to be honest
Really?
with you. Yeah. And our treatment, Caleb's kind of talking in that early 24-hour time period. But beyond that, oftentimes when they have resistant treatment or resistant symptoms, our treatment's kind of based on their symptoms because it can be different. Like if they're getting a lot of dizziness or double vision, it actually can be what we call a vestibular ocular dysfunction of like how your brain's processing what your eyes are seeing, or it's chronic headaches. The big one that I think a lot of people don't know is like emotional dysregulation. So I'll see it in teenagers a lot where they become very emotional, tearful, where they're not normally a tearful kid. That would be one that I'd say people kind of miss, but then the nausea, vomiting, fatigue is another big one. Decreased concentration in school, so we often have to get kids like special accommodations at school.
Yeah.
Because it's harder to concentrate and harder to kind of get their work done.
Okay. So once you've evaluated it all and you've done the treatment, then what is generally the policy to get them back into the game? You guys call it a return to play protocol? Okay.
Yeah, so what we do at Mines, and what is pretty common across the country, is that we focus on getting their symptoms reduced to basically nothing as best as we can. And we can do things, like doing some treatment on the neck, helping that, because that can sometimes cause some headaches as well. But again, we want those symptoms to go away. That's the first thing we want to do. Once those symptoms go away, we retest them. With our SWAY app that we use, and that's a lot of balance, some cognitive things, how do their eyes react, reaction times, things like that. Once they pass that, then we get into kind of our return to play, and that's typically a 5-day return to play protocol where we start with just a light bike ride, increase their heart rate a little bit just to make sure that the symptoms don't come back, and then the next day we get them and we do some body weight workouts. Really make them kind of push through some squats, push-ups, sit-ups, things like that, just to kind of get them moving again. And then we start working on getting them back in the weight room, and then we do about 15 minutes on the third day of just physical activity, typically with their sport. And then we get them back into their sport, and we have them do as much practice as we feel is comfortable and safe for them. And then on the 5th day, we really get them back into full contact. And then typically day 6, we feel like they're fully cleared and safe enough to get back to participation.
Now, both of you have mentioned this sway system. You said sway app. Mm-hmm. So explain this, because this is something relatively new, isn't it?
It is newer.
Okay.
There's the concussions are such a big topic now that there's multiple ways to kind of help you determine if there's a concussion and then help you get them back to sport safely. So it's basically an app that we can use on the sidelines, wherever we are at, and it can help determine how well they do with their balance. And then again, like I said, with reaction time, eye movements, and memory also. So really for the kids, they feel like they're playing a video game when they're doing this testing. But you can put the phone up on your chest, and it will while you do the balance to start off with, and then it will actually tell how much you're moving and swaying. And then that will determine, and then it will decide how close that was to your baseline that we did at the beginning of the year. And then that helps us determine how well their balance is. And then again, then we go into reaction times and memory, and it does all of this stuff that just right there on the phone, so we can do it right there on the sideline. And then it brings us the data back immediately, so we know within a percentage of how close they were to their baseline. Now, it's not a diagnostic tool, but what it does is it helps us determine if it is a concussion or not. And then it also takes their symptoms, and so every day we can send them a link, and they'll put in their symptoms, and then we know exactly where they're at for the day. And so it's just a really good tool that we use that makes it a lot easier for us to do all this testing. I mean, there's other ones that you have to do. You have to sit at a computer, and you have to have a computer lab to test all these athletes, where everybody pulls out their phone at the beginning of the year, we do the test, and they're good to go. And then whenever they're on the sideline, I always have my phone with me. And so we just do a quick test right there on the sideline on my phone, and then we can make a pretty quick decision depending on if we feel like we should pull them from the competition or not. Is
this a rather inexpensive thing to use for high schools and things like that, or like even smaller schools? Is it something they can use?
It's a little bit more price. It's on the pricier range of things. You have to pay per athlete.
Got it.
And so we have over 300 athletes at South Dakota Mines, and so. But the nice thing is you always like to say there shouldn't be a price on your athlete's health, but it is something that we feel is important, and so that's something we'll spend our money on compared to, maybe something else.
Yeah. Now, what are the dangers of more than one concussion? I mean, obviously you don't ever want to have one, but is there a point where you will tell some of these athletes, look, you've had a fair number, maybe maybe you don't get to play next year, or maybe there is a different career choice sport?
I think it comes down a lot to, there's not always a finite number.
Right.
I think it's how you recover to them. So oftentimes what we see is the more you get, the harder it is to recover from it. Right, and so we're showing that your brain's having a harder time coming back from it. So if you're starting to look, maybe the first couple you got, it took you a week, 2 weeks. That would be kind of the typical range to come back. And then all of a sudden we're looking at it took you 3 months. We need to really reevaluate here on what's actually going on. Because like we said, there is a lot that's not known about concussions, and they're doing a ton of research. But if it's taking your brain that long to come back from it, is this really a good idea for you then? If you have several of them, is this happening every season? So now your brain's really prone to them. Once again, it can do emotional dysregulation, cause all of these symptoms that can actually become more chronic in nature that we don't, we want to really prevent. Because at the end of the day, sports are for fun, but if they now start affecting the rest of your life, we got to, take that, and help athletes understand that.
Have either one of you had a concussion?
Not that I'm aware of. I'm probably sure I did when I was younger, but
yeah, I can think of a couple instances when I was younger and didn't know that's what it was.
Well, and that's I can think of instances because I also grew up in a very small school and played most all of the sports, and I know there was a couple times in football where I was hit hard enough to where it was a couple seconds later where your eyes are opening and you're like, oh boy, that hurt, but then nobody really talked about it much back then. So it is becoming a much more, like you said, studied
And I would say athletes also understand it better now. Initially, when we first started doing all these concussion protocols and return to plays, we found that a lot of athletes were trying to cheat the system a little bit. In best intentions,
right.
you know. But they're like, you know, it's just our trainers and our athletic trainers and physicians being overly careful. But then they've seen it happen where, you know, you don't necessarily tell us your symptoms that you're experiencing. And then you go back out and play and take that second hit. And that's usually when the symptoms become really severe. And then it takes a long time to recover because your brain was already at a vulnerable state, and then you took a second bad hit because you're not protecting yourself because you're having symptoms.
Right.
And that's, you know, so what we found is athletes are a little bit more honest with that now, and they're more open with it to say, like, yeah, okay, like, yeah, this did happen.
And I'm sure that education, that just making them feel comfortable enough to be like, look, you know, please, this is for your own good. You know, you're not gonna be cut from the team. You're not gonna be, so be honest about it and let's get help.
Yeah, and it's been really positive, and I'm sure you agree, Kaleb, but to see athletes, how they're responding to it now, it's a good trust system of like, okay, I do understand where you're coming from, and I want to meet you in the middle, and let's both of our goals are the same, to get you back on the field and back playing, but how do we do that safely?
Excellent. Dr. Abbie Metzler and Kaleb Briney, I want to thank you guys both for coming in and talking with me again. This has been super enlightening. What you guys do, and now I think what a lot of the world and parents specifically, you know, I want them to understand that when your kids are playing sports, specifically around here with Monument Health, with the Hard Rockers, of course, if they're going to go to school there, that you guys have put a hell of a team together. They're going to make sure that their kids are safe. And I think that's what is by far most important. So, again, thank you guys both for coming in and talking. And anytime we can talk sports, let's do it. This has been fun.
Thank you.
Yeah, thank you guys.